The ideal way to clean your teeth is no mystery. Even small changes in your home dental care can lead to longer-lasting teeth. Typically, by the age of 50, the average person will have crowns, bridges, partial prostheses, and sometimes even a full prosthesis. Here you see various x-rays of patients from a number of different dental practices. Have you noticed that all of these patients, and presumably you as well, only have quote-unquote bad teeth in the posterior region of the mouth? In all of these images, anyone can tell that people receive fillings, crowns, and bridges, which are the light spots on the x-rays, in the posterior region of the mouth first. Why? People often brush over their teeth in a superficial manner, allowing their thoughts to drift to other things and letting the fresh feeling of the toothpaste mislead them. The anterior teeth are usually sufficiently cleaned through this process. But the posterior region suffers brushing deficiencies, and this has consequences. Hidden plaque, especially in the gaps between teeth, leads to the destruction of the dental enamel after a period of time. Caries and an infection of the gums called periodontitis can be the result. This is why we often get fillings in the posterior region first. If this is compounded by bad dental work and bad education, then by the age of 50, most people have none or only broken teeth in the posterior region. Because of this, the anterior teeth are overburdened, and by the time a person reaches the age of 60, a full prosthesis becomes reality. You can find out more about this in the video entitled Caries. Thus, if you were truly born with bad teeth, they would all be bad. Fortunately, however, inherited bad teeth are rare. People affected by this phenomenon lose all of their teeth at a young age. You can find out more in the video entitled Dental Anomalies. Thus, your posterior teeth are or were just as good as your anterior, and the condition of your mouth will profoundly change. Number 1. Remember to clean the difficult areas first. Your toothbrush is just a tool in your hands. It can only clean those teeth to which you guide it. Keep in mind that every tooth has several surface areas, a fact that is often easily forgotten. The longer you brush your teeth, the less motivation you have to keep going and to do well. Therefore, keep the easy parts, in effect the front teeth, until the very end. Begin with the inside surfaces in the lower and upper jaw. After that, move to the outside surfaces. Finally, brush the chewing surfaces and the anterior teeth. In the beginning, inflamed gums might bleed heavily. However, please continue to brush thoroughly anyway. Number 2. Check if they're well cleaned. What's fun for kids should also be used by adults every now and then. Plaque-disclosing tablets. To begin, you brush your teeth. Then you chew a special plaque-disclosing tablet, which can be bought in most pharmacies. Anywhere plaque is still present will turn a specific color, for example, blue. Color that can be wiped away with the tongue is just colored saliva. Any remaining color is dental plaque that wasn't removed by brushing. You'll have to go over the colored regions again. Using plaque-disclosing tablets is a good way to easily learn a new brushing technique, in effect reprogramming your brushing habits. Point number 3. Use a water pick once a day. More on that in the video by the same name. And number 4. Find a good dentist who takes the time to explain these correlations to you. These 4 points will help you avoid having to get a prosthesis in the future.